Hello, I'm Jamela Jad Ihariel and today I'm going to demonstrate wound cleaning and dressing application. Definition: a wound dressing is the application of sterile pad or compress applied to a wound to promote healing and protect the wound from further issues or complications. Assessment focus: allergies to wound cleaning agents, the appearance and size of the wound, the amount and character of exudate, complaints of discomfort, the time of the last pain medication, signs of systemic infection such as elevated body temperature, diaphoresis, malaise, and leukocytosis. Before changing a dressing, determine any specific orders about the wound or dressing. Purposes: to promote wound healing by primary intention, to prevent infection, to assess the healing process, and to protect the wound from mechanical trauma. Equipment: bath blanket, moisture bag, mask, acetone or other solution, clean disposable gloves, sterile dressing set if none is available. Gather the following stirring items from a central supply cart: drape or towel, gauze squares, container for the cleaning solution, 2 pairs of forceps, gauze dressings and surgipads, applicators or tongue blades to apply ointments, additional supplies required for the particular dressing, and tape, tie tapes or binder. Intervention: introduce yourself to the patient. Explain the procedure. Wash hands, wear clean gloves, and prepare the client and assemble the equipment. Acquire assistance for changing a dressing on a restless or confused adult. Rationale: the person might move and contaminate the sterile field or the wound. Assist the client to a comfortable position in which the wound can be readily exposed. Expose only the wound area using a bath blanket to cover the client if necessary. Rationale: undue exposure is physically and psychologically distressing to most people. Make a cuff on the moisture-proof bag for disposal of the soiled dressings and place the bag within reach. It can be taped to the bedclothes or bedside table. Rationale: making a cuff helps keep the outside of the bag free from contamination by the soiled dressings and prevent subsequent contamination of the nurse's hands or of sterile instrument tips when discarding their dressings or sponges. Placement of the bag within reach prevents the nurses from reaching across the sterile field and the wound and potentially contaminating these areas. Put on a face mask if required. Rationale: some agencies require that a mask be worn for surgical dressing changes to prevent contamination of the wound by droplet spray from the nurse's respiratory tract. Remove binders and tape. Remove binders if unused and place them aside. Untie tie tapes if used. If adhesive tape was used, remove it by holding down the skin and pulling the tape gently but firm toward the wound. Rationale: pressing down on the skin provides counter-traction against the pulling motion. Tape is pulled toward the incision to prevent strain on the sutures or wound. Use a solvent to loosen tape if required. Rationale, moistening the tape with acetone or a similar solvent lessens the discomfort of removal, particularly from hairy surfaces. Remove and dispose of soiled dressings appropriately. Remove the outer abdominal dressings or surgipad. Lift the outer dressing so that the underside is away from the client's face. Rationale, the appearance and odor of the drainage may be upsetting to the client. Place the soiled dressing in the moisture-proof bag without touching the outside of the bag. Contamination of the outside of the bag is avoided to prevent the spread of microorganisms to the nurse and subsequently to others. Remove the underdressings, taking care not to dislodge any drains. If the gauze sticks to the drain, support the drain with one hand and remove the gauze with the other. Assess the location, type, color consistency, and odor of wound drainage, and the number of gauzes saturated or the diameter of the drainage collected on the dressings. Discard the soiled dressings in the bag as before. Remove gloves, dispose them in the moisture-proof bag and wash hands. Set up sterile supplies. Open the sterile dressing set using surgical aseptic technique. Place the sterile drape beside the wound. Open the sterile cleaning solution and pour it over the gauze sponges in the plastic container. Put on sterile gloves. Clean the wound if indicated. Clean the wound using your gloved hands or forceps and gauze swabs moistened with cleaning solution. If using forceps, keep the forceps tips lower than the handles at all times. Rationale, this prevents their contamination by fluid traveling up to the handle and the nurse's wrist and back to the tips. Use the cleaning methods to clean the wound. Clean a wound from top to bottom starting at the center. Clean a wound outward from the incision. Clean around the drain site using a circular motion. Use a separate swab for each stroke and discard each swab after use. Rationale, this prevents the introduction of microorganisms to other wound areas. If a drain is present, clean it after the incision. Clean the skin around the drain site by swabbing in half-full circles from around the drain site outward, using separate swabs for each swipe. Support and hold the drain erect while cleaning around it. Clean as many times as necessary to remove the drainage. For irregular wounds such as the cubitus ulcer, clean from the center of the wound outward using circular strokes. Dry the surrounding skin with dry gauze swabs as required. Do not dry the incision or wound itself. Moisture facilitates wound healing. Apply the ordered powder or ointment. Shake powders directly on the wound. Antibiotic powders may be ordered. Use sterile applicators or tongue blades to apply ointments. Ointments can protect the skin from irritation if drainage is profuse. Apply dressings to the drain site and the incision. Place a pre-cut 4x4 gauze snugly around the drain or open a 4x4 gauze to 4x8. Fold it lengthwise to 2x8 and place the 2x8 around the drain so that the ends overlap. Rationale: this dressing absorbs the drainage and help prevent it from excoriating the skin. Using a pre-cut gauze or folding it as described instead of cutting the gauze prevents any threads from coming loose and getting into the wound, where they could cause inflammation and provide a site of infection. Apply the sterile dressings one at a time over the drain and the incision. Place the bulk of dressings over the drain area and below the drain. Depending on the client's usual position. Layer of dressings are placed for best absorption of drainage, which flows by gravity. Apply the final Surgipad. Remove gloves and dispose them. Secure the dressing with tape or ties and wash hands thoroughly. Document the procedure and all nursing assessment.